turn to the right again, and now turn to the left as far as you can in both directions. So that's before we go to head extension. Okay, go ahead.
As we saw, Max has a little bit of scapular winging, which means that he has a little bit of weakness. It's usually because of a nerve that's pinched. So we're going to use this saline, lidocaine, and sugar water fluid that's going to be used to hydrodissect the nerves. Actually, we're going to be hydrodissecting right in his neck, where this nerve comes out of the neck.
Out of the spine. That's going to be C6 nerve root.
So on the screen, that's the nerve. It's like a little circle. And we're going to go right down to it with the needle, but not go into it. Quick pinch here. This is a kind of aspiration is clear, and the screen's really magnified so you can see clearly. We're about 1 centimeter under the skin. The fluid goes around the nerve and gives the nerve space to get oxygen, blood supply, and restore function to the muscle. So we're decreasing pain and increasing function of the muscle at the same time.
Yeah.
Now we'll test it again and see how it does.
You want to sit up? Sit up facing that just for a second. So here, chest up, hold your shoulder blade against the hand and push your back. Nice slowly. Yeah, just kind of push forward with your push up. Yeah, there we go. Stop forward. See, come on, this. That's pretty similar on both sides. They feel different?
Yeah, it's kind of similar a little bit.
Move that
Still have
muscle
that,
around
like,
a little bit.
I don't know, but like the clicking and
Right.
right.
Yeah. Chest up a little bit more. Push. And push. There's a little bit more on the right than the left. So let's get the C5.
Yeah, you can see it moving behind his, out of his skin.
Yeah.
Feel
Yeah.
like it's doing all here too.
Yeah, I feel it kept clicking and popping.
Okay, let's do the next one.
So Max told us that when he did MRI of his neck years ago, he had some discompression, and that was putting pressure on these nerves. So these nerves probably haven't worked quite right for a little while. Quick pinch. Now we're right around the nerve on the bottom side of the little black circle. And letting the nerve lift right up off the needle.
The bevel techniques, we have the bevel facing the nerve.
Allows the fluid to go really close to the nerve, but not into the nerve or have the needle go anywhere into the nerve. Just gently around it.
That's good. So go ahead and sit up.
That looks better.
Feel better?
I think so, a little bit.
It looked a lot better.
It did, yeah.
It does feel different now. Yeah.
Good.
It's like, I think it feels more stable actually,
Yeah.
but yeah, it does. I'm still getting that clicking grinding, but maybe that's.
Oh, that's the joints. Yeah, that's different. Okay, good. So we got the.
It's like that.
Yeah.
Yeah.
A little bit of motion. It almost seems like it's caught
Now,
connected to
move
the shoulder.
move the other shoulder the same way. Both at the same time.
All the way up.
Pretty similar. Yeah. Yeah. Looks like it's more locked in. I can do one
It does
more.
feel a little stronger.
Yeah.
That definitely
Yeah, that made
Yeah.
an improvement, but
Yeah, this looks pretty even actually. I'm not sure what.
you could do one more where?
Right
C5?
over the first rib, you can get that.
Mhm.
Over the first bundle of serratus anterior.
Yeah.
That's kind of where it gets caught between the clavicle and the serratus anterior.
Okay.
Catch possible catch point. Okay, let's do that. It's gonna be 25. Pretty good. 25 2. Gonna reach your arm towards your feet a little bit.
There's one.
It's a great process.
Mm-hmm.
Go right over these serratus anterior, which is this muscle right here. And then it's like this fascia thing right around here. It's gonna be dorsal scapular, thoracic dorsal, suprascapular. And the ring on there can be that subscapular and then suprascapular.
Fabulous. He's a genius. Quick pinch here. Watch the muscle there and start hurting. Yeah, they rip apart. There you go.
Yeah, that's cool. All right. So that's it. Let's see. That's push. Oh, that's pretty. That's definitely not winging.
Yay.
Yeah.
Oh, that's
Much
it.
better. Okay. Good. So this is the clavicle, and this is the AC joint, and that's the acromion. So we're going to inject right between the two. The acromioclavicular joint.
Quick pinch. See the needle come right into
there,
screen?
perfect. And inject once we see.
Max has had shoulder pain for 10 or 11 years, and he's an awesome athlete, but his shoulder at some point doesn't heal without some extra support. There's not a lot of blood flow to ligaments and to this AC joint, which is held together by a ligament. It wasn't able to regenerate with no matter what physical therapy he did. The end of the clavicle, what was it that you were told you had?
Oh, the distal clavicular osteolytis.
Yeah.
Yeah, so
It kind
that's
of
the.
resorbs. It kind of resorbs and comes back. Depends on how irritated it is.
Mm-hmm.
So it should hopefully get it back.
Placental tissue matrix is the growth factor from placental stem cells. It includes collagen, fibronectin, laminins, all the things that your ligament is made out of and your joint is made out of. and then all of the things that you want to have in there to prevent tissue breakdown
You felt it, right?
and
Yeah, it's
prevent
that pain.
inflammation.
Yeah, that's the
And
pain.
it'll
Yeah.
stimulate regeneration
My
over
legs
the
are
next
coming
3
in with
months.
liver and stuff though. That's when I was training like total bodybuilder, hypertrophy,
Oh yeah.
and all that. That's and I weigh a lot more too.
Oh yeah. Yeah, all that way.
Yeah.
The thing is too, bodybuilders do their presses here, and that's hurting the joint. Whereas here is how powerlifters do it. It's not like here the force goes into the joint, here the force goes into your upper back.
Oh.
So it works for muscle building, but it's not good if you have a joint problem.
Yeah.
All right, so let's see here. Next one is gonna be
What is that?
yeah. Maybe we'll do before we do that, we'll do that super smooth. It's a small, probably like a tenth of a cc, not very much. It's a little bit uncomfortable. Sorry about that. I'll tell you in advance, just because tendons are sensitive. So if your arm behind your back, a little bit straighter. There, just okay. So we're gonna come in like this. It's got a little divot coming in.
Yeah.
So when we get to the bone, you see the divot in the bone is?
Yeah.
So when we go to that divot in the bone.
All right.
Below the eyes.
Quick pinch here.
So it's not just something. That's if you're kind of getting close to that.
Here, I'll show you on the screen. There's a little divot in the bone right here where one of the 4 rotator cuff muscles pulled off the bone and took a little piece of the bone with it. So we're going to try to heal that little area and enable the muscle to reattach nicely to the bone and fill back in.
Very narrow, very. You go a little bit this way.
More even. Want a new needle? The taping works.
Okay.
This tape is meant to help hold your shoulder into place while the placental matrix is regenerating and regrowing your labrum and your AC joint. So it's coverall stretch on the bottom, that's the white tape, and that protects your skin from any adhesive from the more stronger tape. This is, again, 2 layers, mainly the bottom layer is for skin protectant, and the top layer is for actual holding the joint in place. It's more strong than rock tape. Rock tape's good, or KT type. They're good for getting blood circulation after injuries, for pain relief. But this is going to be, see how
kind of hold your shoulder in place, basically. Yeah. So you don't have to. Your muscles won't have to work as hard to keep it in. It kind of protects you from dislocating.
This is the acromioclavicular taping, where you put coverall stretch on the skin and then finish it off with the actual functional tape, which is leukotape. And leukotape is good for ligaments and holding bone to bone. It doesn't move as much as the Elasticon. You can keep both of these tapes on for 12 weeks.
Change them once a week, though.
Yeah. And if you're working out more, you can change it after you get really sweaty, but it's pretty waterproof, so you can shower with it on. Okay, that's your taping. Hello, Carol Bender here. Thank you so much for watching. Please like and share our video, and don't forget to subscribe to watch more content like the one you just saw.